Did you know that 6 in 10 adults lives each and every day with a chronic disease or illness? This is widely defined by the Centers for Disease Control and Prevention as one that persists for a year or more and requires continued medical attention or treatment. Or that 4 in 10 adults lives each and every day with 2 or more chronic diseases. I myself had no idea that chronic illness was so common, especially amongst racial minorities in the United States. Minorities experience increased risk factors and increased negative disease impacts from chronic disease than white Americans. The National Academy of Medicine, or NAM, writes that racial and ethnic minorities receive lower quality health care than white people, even when income, insurance, and age are comparable. This all meant very little to me until my 7th grade year of middle school. That's when I began to question if I too would fit into these chronic disease statistics. I distinctly remember that year feeling as though my body was beginning to attack itself. Later, I would figure out that it was. My mother recognized the severity of my symptoms first. And like any concerned parent, she took her questions and concerns to the source of all knowledge, Google. She researched my symptoms, from the fevers to the chills to the body aches to my loss of appetite. There were so many moving pieces, and as my symptoms got worse, I began to question if we would ever be able to make all the pieces fit. With each doctor, my mother brought with her her research and her motherly intuition. For months, the doctors told us that it was just a simple infection that could be easily solved with antibiotics. But my mother and I continued to question how an infection could persist for this long and be impacting my health so severely. 4 months passed, and we'd now seen 6 general pediatricians and 3 pediatric specialists before we met one doctor who was really willing to listen to what my mother and I had to say. From the moment I walked into his office, I knew that this doctor's visit would be different. He didn't meet my mother's questions with amused grins or humored dismissals. He really took the time to listen to what she had seen and observed, and to ask me how I felt that my disease had progressed to this point. He even went as far as to take my mother's research logs home with him that night before giving us an official diagnosis. The next day, he sent us to Children's Hospital of Atlanta, where his diagnosis was confirmed. One day after this initial meeting, I was diagnosed with systemic lupus erythematosus, or what is commonly known as lupus. Lupus is defined as an inflammatory disease that's characterized by the body's immune response to attack its own healthy tissues. By the time I was diagnosed, the lupus inside of me had progressed to a point that my mother and I could not have imagined. I was now in stage 2 and stage 4 kidney disease, which explained the swelling I saw in my hands and my legs each day before school. I had liver disease, which explained the back discomfort and the stomach pains that kept me up at night. I had pancreatitis, which made eating an uncomfortable experience that caused me to lose about 50 pounds in the span of those 4 months. I also developed lupus in my skin, which explained the hives and discoloration that, when combined with the weight loss, made me almost unrecognizable to myself. Now I had to question, why did it have to get to this point for someone to listen to my mother's plea for help? NAM writes that some people in the United States are more likely to die from chronic diseases like heart disease, cancer, and diabetes simply because of their race or ethnicity, not because they lack the access to health care. NAM calls this the uncomfortable reality of being Black or brown in the United States. Even in pregnancy, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women in this country. The fact is that minorities feel unseen, unheard, and misunderstood by their healthcare teams. They may question their diagnosis or treatment plan, but feel they lack the agency or the right to push their doctors for further answers. I know that's how my mother and I felt for months as we fought to find one doctor who was willing to listen to how this illness was impacting not just my health, but my education, my family, and my ability to be the 7th grader I so wanted to be that year. For 1 month following my diagnosis, I did not leave Children's Healthcare of Atlanta. And each day I lay in that bed fighting for my life, my mother insisted to me that this disease was now my own. The doctors had done the hard part in giving us a name to what was happening. I knew I had lupus now, but this lupus was not her responsibility. It wasn't my father's responsibility. It wasn't my doctor's responsibility. It was my own. She emphasized to me that it was now time to take my care into my own hands. And for me, taking my disease into my own hands meant diving face first into the lupus research so that I could better understand how lupus was impacting pediatric patients just like myself. They had to take their care into their own hands now too, right? When I was 17 years old, alongside Dr. Sampath Prahalad, professor of pediatric rheumatology and my personal rheumatologist, I conducted a 2-year study of the impact of lupus on quality of life outcomes on pediatric patients. I wanted to compare quality of life perceptions of these patients to that of their parents. My study found that patients saw themselves as having a greater decrease in their quality of life post-diagnosis than their parents had perceived. The second half of my study focused on the time lapse between age of onset and age of disease diagnosis. I wanted to analyze if there was a longer delay between people of different racial backgrounds. I hypothesized that minority race people would have the longest delay in a lupus diagnosis, but my hypothesis was not supported in the subject group. The research found that white individuals and people of 2 or more races had the longest delay in their lupus diagnosis. This is probably because lupus is most common in Black and brown women, which may cause a doctor to question this diagnosis in people of another race. Although my hypothesis was not supported in this subject group, the larger body of research surrounding minorities in healthcare finds that institutionalized bias in the healthcare system contributes to Black and brown patients having a harder time receiving early diagnoses for their disease. The disparities that exist in healthcare contribute to Black and brown patients having a decreased life expectancy of almost 4 years compared to white Americans. So if we know that minorities are more likely to die from chronic disease and that implicit and institutionalized bias contribute to Black and brown patients having a life expectancy that falls almost 4 years short of their white counterparts, what can we do now moving forward to ensure that all people, regardless of race or ethnicity, have the agency to advocate for their own health? In my opinion, this is a twofold answer. First, we must start by educating healthcare workers and professionals on how to question their implicit bias, while simultaneously equipping patients with the agency to advocate for their own health. Education is the starting point for breaking down the implicit bias that exists in the healthcare system. We must force people to question their own thinking and to ask themselves why, when treating someone of a different racial background or ethnicity, you may consider them with less regard than you would someone of the same racial background. Once we begin to question these biases, we can begin to open up the lines of communication between providers and the people who depend on them for care. By opening up the lines of communication, we are creating more transparency and improving health outcomes through increased self-advocacy. People will begin to speak up because they don't only feel heard, but respected in the decision-making process of their health. It only took one physician's willingness to listen to what my mother and I had to say for my health to take a turn for the better. For me to feel heard, I had to learn how to read my own charts and lab work so that my doctors could see that I was hungry for more knowledge. For someone else, it may look like a longer than average conversation with their doctor that doesn't feel rushed. For someone else, it may be a doctor creating more lines of communication to allow for more in-depth dialogue. Learning how to manage my care early made it easier for me to recognize the signs when I began to experience my second severe lupus flare. Although I didn't know exactly what was wrong, I knew that something was wrong. I knew who to reach out to this time and how to explain what I was experiencing. The doctors were able to catch the lupus that had now spread to my brain. I'd now developed lesions on my brain that left me in a coma-like state for about 5 months. Although I'd missed half of my academic year and I had to now spend 5 months in a hospital, I did leave the hospital. Race cannot and should not be ignored. It should be considered when treating any patient. Race plays a major factor in predisposing certain individuals to certain health outcomes and diseases. Race should not limit someone's access to quality care or inhibit a provider from providing the best care possible. This begins with breaking down the implicit bias that persists in the delivery of healthcare, opening up lines of communication, and improving the patient-provider relationship. This is the foundation for equitable outcomes for minorities in this country moving forward. While doctors and healthcare workers are being educated on how to effectively question their thinking and biases, I challenge all people living with chronic diseases, especially minorities, to remember that no one can advocate for you better than yourself. That's the lesson my mother taught me early on that I will carry with me for the rest of my life. If she had not, I may not be here today to share this story. I may not have been able to alert my professors or my care providers when my lupus triggered again for the second time during the first year of college. Breaking down bias is not an easy task. Learning how to manage your disease, its symptoms and signs is not an easy task. But when paired, we can begin to move the bar of care closer and closer to equity. Thank you.